So I'm talking about future therapies and practical patient selection. So Kevin covered some of the stuff we're going to talk about, which is I think one of the areas that we're seeing is that we have a tremendous explosion in the number of BPH treatments, right? And with these treatments, we need to sort of figure out who's the right patient for the right treatment. These are my disclosures. All right, so we've already seen this slide, I think, 3 times now. So as you can tell, it's an important slide talking about the fact that when we talk about male LUTs, right, lower urinary tract symptoms, it's multifactorial. So it's not always BPH, and sometimes there's bladder components. And when we talk about bladder components, even within BPH, there's the concept of bladder health, right? So the idea that the bladder is strong at some point, and over time, the bladder, like the heart, will teeter out. All right, so how do we diagnose now? Well, one is we've got our history. So patients like, I got weak stream, I've got some urgency frequency, we go BPH, right? And the second thing we have right now is we've got that uroflow, which half the time patients void a tablespoon, and you're like, I guess you have BPH? And you've got the transrectal ultrasound, which basically gives you a size of the prostate. But ultimately, there's a lot of technologies that are looking to change that and also enhance our ability to understand bladder health, bladder function, and the role that the prostate plays. So one is when we look at voided volume in the office, we know that the office uroflow actually underestimates bladder volume by about 30%. So a lot of times patients will come in and say, I really have to pee, and they're voiding 150, 200 cc's, but their bladder capacity may be much larger when you look at it compared to a bladder diary. So one test, who here uses the penile cuff test, the Eurocuff? No. So I think Eurocuff is actually incredibly helpful. It's basically a pressure cuff that's placed on the penis, and it gently squeezes the penis as patients urinate. And as these men urinate, it gives you an idea of what their bladder health is. So ultimately, we did a systematic study looking at 17 different studies, 5 studies with the pressure control test, and basically it shows that the penile cuff test is sufficient at diagnosing bladder outlet obstruction. And I think what's really neat about it is you get this diagram, you get something very crystal clear for patients that, hey, you're in this green box right here. You're doing okay. Your bladder function is good, your flow is good, and over time, as the bladder starts to weaken, you start seeing obstructions or low pressure, low volume. It helps patients understand the, what the dynamics are between their bladder health as well as obstruction. There's another therapy called, not therapy, but something called CarePath. I'm not sure who in the audience is using it. I know Ilya says that he's been using it, but it's a very helpful thing for patients to understand where they are in their pathway and what options are. So basically, it's a combination of a Euroflow device that's connected via cellular. It has a patient navigation tool that goes with it. It also gives you patient education. So in other words, a lot of times with all the pressures we have in the office between, billing, compliance, getting stuff in, it's hard to get all that information to patients about what bladder health is, what's going on with the bladder, what options are. And obviously it motivates patients to get the right treatment. So here you can see on the right side, if you take a look at the current market, it's about 2% of men go on to have a BPH procedure. With a CarePath in various practices that have adopted it, they've noticed it to be a 6% improvement. And in their pilot studies, up to a 40% improvement. But essentially, you've got this handpiece that's designed for both men, and there's one for men, one for women. They urinate into it. It gives you a bladder diary. Also gives you tremendous information on their voiding habits and figuring out things like nocturnal polyuria, overactive bladder, enlarged prostate in men, obviously. There's also a growing world of sound-based technology, which is called sono-uroflowmetry, which is using voiding acoustics. I think we've seen this in pediatrics quite a bit, where you can hear the sound of a child voiding, and from there you can figure out their pattern to figure out different voiding dysfunction. And there's been a slew of therapies that have come out, a slew of diagnostics that have come out. What's interesting about this sound-based technology is that it's been out for a while. Actually, it was first described in 1976 with using a colored piece of paper, and patients void into this contraption, and essentially this paper scale will tell you what their flow patterns are. But for the longest time, we've known that the office-based diagnostics don't always give you all the information that you need. So one is called Telo-Sono-Uroflow, and you can see based on this technology, you can see how it matches the conventional Uroflow quite well. But what becomes interesting is in certain audio and certain patterns, sometimes you do lose that and you end up losing a diagnostic accuracy right here. There's another technology called Proud-P, and I think Kevin already asked the question who used it in the office, but I've been using this quite a bit. And basically, it's a sound-based Euroflow app. It's HIPAA compliant, and it's based off of 300,000 Euroflow samples. And here we can see that this is a flow pattern looking at males, and you can see how well it matches the Euroflow. And using this in combination with the bladder diary helps you understand, one, patients are able to, you and the patient are able to communicate a very similar language in terms of what the flow patterns are, what the voiding diaries look like, how often they're urinating. They've actually done a similar study in females as well. And then I think one of the newest things that we're seeing that is going to be coming out soon is this idea of ambulatory urodynamics. So as we know, when it comes to urodynamics, uncomfortable tests, lots of disposable costs, lots of issues with diagnostic accuracy and how urodynamics actually predicts outcomes. So this is basically a ambulatory unit, and you can see this is what's inserted into the bladder, and then you have the ability to get software to analyze that. And in their preliminary study, when we're doing urodynamics, there's up to 30 to 40% non-diagnostic rate because men or women are unable to void during the urodynamics. It's easily removed and minimal pain, less than a cystoscopy. So ultimately, this is showing what we're able to do down the road in future, sort of figuring out better diagnostics for these therapies. So why is this all so important? I mean, ultimately what it boils down to is that when we look at the variety of therapies that are out there, obviously, we've got medications, which we've all poo-pooed here and talked about how lots of men want to get off of it. We've got the minimally invasive therapies, which is UroLift, Resume, iTind. We've got the open prostatectomy, TURP, HoLEP, PVP. And between these therapies, we know that certain patients do better with certain therapies. Like, for example, there's some data to suggest that if you have a weaker bladder, maybe you do better with cavitating surgery, right? And the idea is that once you have these apps and these different information, we're able to understand how bladder health plays a role. And in addition to that, there's a whole plethora of future therapies coming out, which I think, which Kevin also brought up between, we have iTind, we've got Butterfly, we have the Urotronics, we have ZenFlow, and all of these have their own proprietary sort of placement as well as how long they're indwelling for. Some of them are designed to be indwelling for 5 to 7 days, some are designed to be indwelling for about 6 months, and some are designed to be there for a perpetual amount of time. So from this, we know that these novel diagnostics provide many data points which reduce the non-diagnostic flow tests. We get more information than just the history. We want to understand this concept of bladder health. So we know that over time, the bladder does change function, right? And earlier intervention likely leads to better outcomes for these men. And it also improves the patient experience where maybe we're doing less of the, well, that didn't work, let's try something else. And we're getting them to the right treatment right away. And also improves patient selection and experience through the BPH journey. Thank you.